Let me provide you a little bit about the history of Check Your Genes. Check Your Genes was formed after my sister was diagnosed with ovarian cancer in 2001. And I need to take you a little bit back in our family so you can get that diagnosis of ovarian cancer in context. My mom died of breast cancer at the age of 49. Her sister, my aunt, died of breast cancer in her 40s. My sister and I, Nancy's seen in this picture, we knew breast cancer ran in our family, but we didn't know what to do with that information. We didn't know about genetic testing. So when she was diagnosed with ovarian cancer and the doctor found out that our mom and our aunt had both died of breast cancer, the doctor said, "You probably have the BRCA gene. Have you been tested?" My sister said, "What test?" It was at that point that we realized there was a communication problem. There was a problem with getting accurate information out to the public and encouraging those families that have that family history to go and seek genetic counseling and get this life-saving genetic test. So we began working with the genetic counselors at our local hospitals, Cincinnati Children's Hospital and St. Elizabeth Healthcare, to figure out what we could do as a small grassroots nonprofit organization to try to educate the public on this life-saving test. And what we did was we thought we could do that the best through getting the word out directly to the public, similar to what drug companies do with their advertisements that you see on the nightly news every night. They ask you if you have a history of some disease. So we thought we'd ask the public, does breast or ovarian cancer run in your family? If it does, then you need to get this test. You need to go to a genetic counselor and seek out medical advice, because you could potentially be at a significantly increased risk for developing breast and ovarian cancer. So that's why we formed this local nonprofit organization, and we found the most effective and cost-effective way of getting the word out was through the internet. We had a website developed, and we partnered with St. Elizabeth Healthcare and Cincinnati Children's Hospital. We put genetic counselors on our board of directors, and we wanted to do that so we would have accurate medical information going on our website. Our website is tops whenever you search for BRCA. If you search for genetic breast cancer or ovarian cancer, our website pops up and it's accurate medical information. So that's the history. So after my sister was diagnosed, she wanted to make sure that this wouldn't happen to anybody else. She wanted to try to save lives, and that's why we formed the organization. Unfortunately, my sister lost her battle to cancer at the age of 40. She died in 2009. However, the board of directors and our local organization, our connections at the hospitals, decided this was an important cause, something that we needed to keep going, even though my sister had died. So we agreed to keep the organization open and active, and we're still to this day trying to ask people out there in the public, does breast or ovarian cancer run in your family? If so, it's important for you to get tested. So what we've been doing recently is trying to identify people who need to have this information. And one of the groups that we figured out pretty early on needed to have this information would be family members of people who have tested positive for this genetic change. We think there's a real disconnect between a family member getting tested and that family member notifying the other potentially affected family members of their diagnosis. So we wanted to make it seamless. We wanted to make it easy. Thus, the family notification tool that's on our website. So, educating the public will save lives, and that's what we're all about. There's the mission, to educate the public and healthcare professionals on the need for a formal genetic risk assessment and testing if an individual has a family history of breast and ovarian cancer.